Hi, I am Dr. Marco Flores. It's a pleasure to be here and bring to you this presentation on behalf of my college and myself. For reasons of time, my translator will communicate what we did in this research.
Best regard to all. Our topic is called Netnography Methodics in the COVID-19 Pandemic from a Human Digital Ecosystem of Physicians. This research was conducted with the participation of Joypin Betancourt, PhD, the doctoral student Evelyn Hernandez, Maria Lourdes Piñero, PhD, and Marcos Flores, PhD. The COVID-19 pandemic was a public health phenomenon with multiple dimension and recursive interrelations. It was a complex phenomenon which called to be understood. In this context, health personnel, specifically doctors, became ill and died while providing their services. This research focused on occupational health through a digital medium in a public health phenomenon. The working conditions of doctors in Venezuela were full of uncertainties and unsafe circumstances. At the same time, health centers lacked occupational health and safety management systems. Due to the above, the health work context during the pandemic required an ecosophical interpretation and approach from the human in the digital environment to assess the daily experiences of the medical practice, intersubjective relationships, and sociability in the epidemiological context itself. The purpose of this study was to understand the circumstances of confinement, the challenges of netnography research in this area, and that there was no evidence of similar studies in the occupational health. The main purpose was to reflect on the signifiers and the meanings that doctors attributed to medical practice and working conditions in the COVID-19 pandemic. The global health reality of COVID did not go unnoticed, with WhatsApp digital platform being the main real-time communication tool. This is how the problematizing concern arose regarding what were the signifiers and meanings that doctors attributed to medical praxis and working conditions in the COVID-19 pandemic as a human digital ecosystem in online reality, as the only way to access reality offline public health. From this digital context and with the purpose of methodologically weaving the purpose of the study, I transmuted the naturalistic observation into non-participant observation, assuming that ethnography is a method in construction, epistemologically recognizing the ethnographic essence, while the origin of and practice is anthropologically, social, and cultural with exceptional methodological particularity and suitably to enable the approach of the objects of study with a qualitative perspective in cyberspace, non-physical place. The study subjects chosen as subversioners were 162 physicians who interacted in two native communities. 90 physicians specializing in different medical disciplines, 72 occupational health specialists respectively, constant interaction between them in 22 months of fieldwork between the dates of March 23rd and 2020 to January 31st, year 2022. The testimonies of the versions in cyberspace refer to digital text and audios of the doctors. The transcription of testimonies was carried out in the information recording protocols, and for this purpose, the technological tools WhatsApp Web and Transcriber for WhatsApp supported the capture of information from MIT WhatsApp from the mobile phone. The systemization of said testimonies was qualitative and manual, according to the guidelines of Strauss and Carvey. Simultaneously, the chromatographic technique used by Piñero Rivera and Rivera. The results of this research were mainly four. Number one, many health professionals face the pandemic in suboptimal conditions. Number two, professional and occupational obstacles during the COVID-19. Number three, innovation from digital sources showed that viability to know the ontology, epistemology, and methodology and procedure. And number four, fraternity, medical praxis, social, hygiene, safety, and occupational and psychological health. Likewise, the hologrammatic elucidation of the categories was interpreted as an nospheric reality based on the thought act of 162 co-researchers. Part of the conclusions were that in Venezuela, even though the number of doctors who fell ill and died was significant, there was no occupational epidemiological surveillance of cases with COVID-19 in health personnel. At no time was there a presumptive analysis, nor were there work accidents, occupational disease, or common disease due to the community exposure to SARS-CoV-2. Nor were there any concrete proposal from the government, actors, and trade organizations to promote within the national SHST policy special regulations for these health personnel.
Thank you for your time and attention.